This is one of my patients, one of my first patients. He had a frozen shoulder, he could not raise it. I gave him a few points and he was able to raise. That is what acupuncture is for: little backache, frozen shoulder, osteoarthritis, fibrositis. Believe me, it's much better than your non-steroidal anti-inflammatory drugs. It works. That's a boy who had a facial paralysis. He was very young. He was about 4 or 5 years old. He allowed me to acupuncture. That is a young person, infant, who had Erb's palsy after forceps delivery. This is a doctor, barefoot doctor, in a night school, by night, treating a youth for deafness. In my clinic, some of the students who come, they have invented a method which the Chinese have not found even in 5,000 years. You know that unique method our students have adopted. They go and ask the patient, where did he put the needles yesterday? That is the front aspect of your arm. And we have the lung channel. Traveling in the following manner. These are the points of the lung channel. And it is connected to the organ called the lung. And underneath that, you know this organ. What is this organ? Large intestine. Very good. And that is called your skin. And somewhere above here is my nose. And all these things are connected to each other. The lung and large intestine are connected to the nose, and they are connected to the skin. And there is another channel, you know, that is running on the back, starting from here. It is running on the point Hoku, Chuchi, on the back surface, going up to the nose, and that is your large intestine channel, which is also related to the large intestine. And that entire thing is called the, which element is this? Metal of traditional medicine. Right? That is the metal element. In other words, we said, can you hold this? This is my element, color white, and attached to my lungs and large intestine, and connected to my skin and body hair. That is what it is. The important points are number 5. Can you remember we spoke about number 5 yesterday in connection with what? Bleeding. Excellent. Number 7. This is the most important point. Number 9 and number 11. When we have discussed these points, that is it. I have told you about nearly all I know about acupuncture. That is all. The lung channel is a yin channel. It has 11 acupuncture points. Right? It is related, it has an interior-exterior relationship with the large intestine. It is related to the internal organ called the lung. It is related to the special tissue called the skin and body hair. It is related to the special sense organ called the nose. And the channel runs from the chest along the upper limb on the anterior and radial part of the upper limb distally to reach the nail of the thumb, root of the nail of the thumb on the radial side. Its important points are 1, 5, 7, 9, 11. It is, the entire system is metal, and it is the son of earth. You know that metals are obtained from the earth. 5-element theory. It is the son of metal. Metal is the son of earth, and earth is spleen and stomach. So, lung and large intestine is the son of spleen and stomach, and metal is the mother of water. From the solid you get the liquid state. Therefore, lung and large intestine is the mother of kidney and urinary bladder, according to the 5-element theory. The point number 1 is called Chong Fu, if you want to know the name. Chong Fu. Chong Fu. Chong means Chong, means center. Right? It starts from the center of your chest. From here, the channels go right to the center and That is the first point. Chong. Chong Fu is located here. Please put your fingers here. Level of the first intercostal space. Now, the first question we ask is when we have a point, any acupuncture point anywhere, we want to know where, why and how. Where is the point? How do you locate it properly? Why? What are the indications for it? And how? The method of puncture. Where, why, how? To find out where it is, there are different methods of location of points. The first method is the method of finger measurement. You take the finger, you find this is called the body inch, the middle here, between the distal and the intermediate crease. This is also a body inch at the widest point. Two of these are 1.5. Chuan is a body inch. Two of these are 1.5 at the widest point. Okay, how much is 4 then? 3, very good. 2 chuan is about 2.5. So how much is 5 chuan? How much is 5 chuan? 5 chuan is therefore is equal to 3 chuan plus 2 chuan, right? Right? 3 chuan is 4 fingers, 2 chuan is 2.5 fingers, therefore these two is 6.5 fingers. 5 chuan is equal to 6.5 fingers, breadth, right? 6.5 finger breadth. Very important. By the way, there is another point here. We will discuss that also. 6. This point is 6.5 finger breadth. 6.5 finger breadth or 5 chuan. This 5 chuan will keep coming all the time. This distance is 5 chuan, and how you locate it is you locate it by 4, 2.5 there. So the location of points in the body, first finger measurement. Second, proportional measurements. For example, the body has different proportions. From here to here is 3 chuan. You understand? For instance, 3 chuan. From here to here is 5 chuan. Like that, they located different lengths. The entire body is in proportion to each other. And that was very, very important because you took the different proportions of the body. Then there are other methods. There are anatomical methods. Tip of the nose, midpoint between the two eyebrows, for example. We already said tip of the eyebrow. These are all anatomical landmarks. We took the pisiform bone, you remember, flexocarpi ulnaris. Those are different landmarks. Another method is called postural method. You get the patient to put into a posture. What is that? That is the posture. Like this, that is posture. Like this, that is the posture. There is another point here. Hoku, Chuchi, large intestine 11. Then there are where the patient sits very comfortably, like she was doing, and the acupuncturist is putting himself into a posture. You remember? To locate points. There are many other methods. Important method, the point of tenderness. Archer points, you remember? OES points. Electrical detection of acupuncture points. And so on and so forth. Why do we use this point? For what? That is all we want to know. And if we learn the principle on which this point is used, we know the principle where all other points in the body are used. So now I tell you the first important secret of acupuncture. Put your finger there. All points are used in the treatment of local and adjacent area disorders. That is the great secret. What did I say? Can we repeat that? All points are used in the treatment local and adjacent area disorders. Of any disorder along the channel, can you say that? Of any disorder along the channel, of any disorder of the pertaining organ, put your hand. Of any disorder of the coupled channel, of any disorder of the coupled organ, of any disorder of the special sense organ, and of any disorder of the connected tissue. Now, is that difficult? No, what the hell, that is the same thing. There's nothing in it. But remember, people forget the simple things. Any point, anywhere in the body, that's it, if they ask you. Thank you. What is lacking is our ability to explain this scientifically. Don't worry about scientific theories. They all write a lot of garbage. It is working, and probably a few thousand years later, they may discover the reason. The first principle of acupuncture is as follows. All points treat diseases of the local and adjacent area along the channel, the pertaining organ, the coupled channel and organ, special sense organ, and tissue, and excess in the mother and deficiency in the son. That is the first principle of selection of points. Now, for your information, as you are very worried already and sweating about these problems that can come, I will tell you where the vulnerable points are. Take your computer card. You find there is a dangerous point. Have you found where they are? Side B in the center. You can puncture anything anywhere you like, even if it is acupuncture or non-acupuncture. But these points we are regularly using, and be careful. Points in the orbit. Can you see the orbit point? Front of the neck, side of the neck, back of the neck. All points on the chest, not protected by bone and cartilage. Over the gallbladder, can you see that? Liangman, stomach 21. And for physiological reasons, which I have already discussed this, Tai Chong liver 3. Those are the dangerous points of or vulnerable points. We are regularly using them. Put your fingers into the orbit, at the bottom of the orbit, right? At the medial end, just above the medial canthus. Bottom of the orbit, right in the middle. And on the lower border of the orbit, at the outer fourth, 3 points. Right. The first one at the medial end is Jingming UB1, urinary bladder 1, stomach 1, Cheng Chi, outer end Chu Hu extra 4. These are all very useful points in treating eye diseases. I showed you a lady with myasthenia gravis, you remember? Where eyes were going like that. I used to use about 1, occasionally 2 points. Very useful. Eye disorders. Myopia, hypermetropia, glaucoma, early cataract, you name it, it is very useful. Bell's paralysis, where your eye doesn't close, we use that. So, UB1, stomach 1, extra 4, points in the orbit. Can you put your finger? Medial end, UB1, bottom, stomach 1, extra 4. Front of the neck, here's a point for acute asthma. In the suprasternal notch. TN2, friend 22. Over the carotids. You take your Adam's apple, 3 chun lateral, neck futu, large intestine 18. Corner of the mandible, underneath that. Tian Rong, small intestine 17. And the upper end of the cervical spine. You can puncture into the cerebellomedullary cistern. Cerebellomedullary, and people have died. Yaman Feng Fu. Between the occiput and first cervical, between first cervical and second cervical. Yaman Feng Fu. Yaman is a very good point for dumbness, deafness, deaf-mutism. But puncture very carefully. You know this is do 14 here. This is do 15, do 16. Do 14, do 15, do 16. Do 15, do 16. Very dangerous. Some people don't use it at all. Then come onto the chest. Put your hand there. Most people look at the chest, the nice, beautiful shape in front of the chest. Remember, there is a chest. Chest, from here you can puncture. Chest and chest. Especially if there is emphysema, it's very easy to puncture the chest from above. It is like a balloon. All points on the chest, chest, chest and chest. Not protected by bone and cartilage. Liangman, stomach 21. Yes. You understand? Liangman, stomach 21, over the gallbladder. Gallbladder is distended, you can puncture it. Cause chemical peritonitis, bile peritonitis, and kill the patient. Tai Chong, liver 3, you know where liver 3 is? Where is it? Put your finger between the big toe and the second toe, from the web, 2 chun, proximal, that means 2.5 finger breadth. Tai Chong, liver 3, that is the equivalent of oak. But when it grows crazy, it can go crazy. Overcorrection of conditions. Right, everybody got the dangerous points? Vulnerable. They are regularly used with needles. And they are very useful. We have to continue to use them. But with care, like a sports car. Very good, very beautiful. But if you use it wrongly, you can kill yourself and other people. You will see in our computer card, prohibited points. Prohibited points. Everybody, put your hand there. Prohibited areas are fontanelles. Nipples, hold your beautiful nipples and breast tissue. Umbilicus, and hold your genitalia. You can do anything you like with these areas, but don't put needles. You understand? Once again. Fontanelles, nipples and breast tissue, umbilicus, external genitalia. Are these prohibited points dangerous? Are they dangerous or not dangerous? Yes or no? Yes. Somebody says yes. How can it be dangerous? You are not going to use it. Are you going to get hit by Halley's Comet this year and die? No. You just forget it. Don't mistake one for the other, you understand? Dangerous, we use it. Prohibited, we forget about it. Another important thing is, we have our body cavity here. This is my body cavity. And inside the body cavity there are how many organs? 12 internal organs in 6 pairs. Each of those organs has a special point in front where the energy level is reflected. That is called the front point or the mu point. The word for front is mu. And in the back there is a point called the shoe point. The shoe point. That's the back point. All the internal organs are reflected in one straight line. 1.5 chun lateral, that is in the medial branch of the urinary bladder channel. Doctor, can I borrow you, please? You see, yes, this is 1.5, this 1.5, that is 2 channel traveling up all the way. From the medial canthus of the eye, that is the UB1, the dangerous point is coming, the urinary bladder behind, and in the upper part of the neck, it divides into 2 branches, I told you, which go down and meet at the point UB40. And these 2 branches are running on either side 1.5 chun. The lateral branch points we don't use. the medial branch points are deadly important, and those are the back shoe points. The shoe points where all the 12 internal organs are reflected here. And curiously, these back shoe points are deadly important because the reflection of these 2 points is in the same order as those of the ganglia of the sympathetic trunk, which are lying exactly underneath that. Thus we have the lung, the pericardium, the heart, the diaphragm, the liver, the spleen, the stomach, and kidney, and large intestine. The Chinese name for these, we just add shu, meaning the back, and that is the name of the point. For example, fei shu, juen shu, sin shu, ge shu, gan shu, dan shu, pi shu, wei shu, and we have shen shu and da chang shu, the sympathetic outflow to those organs. These back shoe points are the meeting point of the anatomist, of the neurologist, of the acupuncturist, of the chiropractor, of the osteopath, because all those are reflected at those particular levels. Now I take the front point, Chong Fu. You remember Chong Fu? 6 June. Chong Fu, right? Chong Fu, and at the level of thoracic tree. What is thoracic tree? Spine of the scapula. Spine of the scapula is thoracic tree. 1.5 chun from the midline is the point Fei Shu. Urinary bladder 13. So lung 1 and urinary bladder 13 are the mu and shu points for the lung. And likewise, you can work out for the other organs. You will see the mu and shu points described in our computer card. The mu and shu points is the next method of selecting points, the front and the back points. In this case, lung 1, and UB13, and mutas mutandis. You will find that for all the other 11 internal organs, there is a front point and a back point. So that is the second method of selecting points for lung disorders, we'll say, or for any other internal organ. Mu point and shu point. Once again, what are the mu points and shu points for lung? Chong Fu, lung 1, Fei Shu, urinary bladder 13. For lung disorders, what do you mean by lung disorders? What do you mean by lung disorders? What you mean by lung disorders is disorders of the lung, disorders of the channel, disorders of the nose, disorders of the skin, and even disorders of the large intestine, channel, and organ. That is the meaning of lung. What is the use of this point? What is the use of this point? Local and adjacent area disorders along the channel pertaining organ, coupled channel, coupled organ, special sense organ, and tissue, right? In addition to that, we have is a point which is used for bleeding. Put your finger there from lung 5. We take a few drops of blood and put it to dash. We do 14. Immune enhancing point, central energy point of your chest. That is from where the circulation starts at 3 o'clock in the morning. What is that point? Shansong, Ren 17. Shui Hai, spleen 10. Shui Hai, spleen 10. You remember the Shui Hai point? Anti-allergic, anti-inflammatory point. And also any archie, any fibrocytic nodule, any tender nodule, anywhere you can inject that. So that is the bleeding. And I also told you yesterday the reason behind the bleeding. You remember? The reason behind the bleeding. So that is bleeding. From lung 5, you draw a line. You draw a line to Lia Chair. Lia Chair. What is Lia Chair? Lung 7. and to the point Kong Sui, which is lung 6. Now, Liache, how do you locate Liache? How do you locate Liache? We already said that. Put 2 fingers and put it there from the wrist crease. 2 fingers proximal. You see the channel goes outwards there. And from that point to this point, we draw a direct line, and that is the lung channel or lung meridian. And along this we measure 5 chun. How much is 5 chun? How many fingers? Half what? 6.5? 5 chun is 6.5? Some people say fingers. 1, 2, 3, 4, 5, 6 and half is, you have to put the needle into the next patient, you see? That's better. Yes, that's more accurate. Okay, put 6.5, 4, 5, 6.5, that is your Kong Sui. Now what is that point Kong Sui used for? Very good. Local, adjacent, along the channel, right, da, 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 okay, all the dots. What is the special use of that point? Yes? Cheek left point means a point used for acute disorders. Acute disorders of what? Acute disorders of everything, of the channel, of the organ, of the coupled channel, of the coupled organ. Your nose is blocked, your nose is bleeding, you are scratching to high heaven. Acute asthma, acute difficulty of breathing, you understand? All of those you can use the cheek left point. Got it? Acute disorders, you can use that. So Kong Sui, lung 6, is called a cheek left point. That is the next important. In every channel, there is one point which is used for acute disorders, and it is called the cheek left point. That is the 4th principle we are talking of. Are we very clear in all this? All what I told you about history and all philosophy and fire, please forget all that. This is all where the action is now, right? If you learn this page, that's it. That's all there is to know, right? All that is very interesting and amusing stuff, but this is where your bread and butter is. In every channel, there is one point which is treating acute disorders. In 12 channels, there are 12 points, but don't worry about them. There are only 3 or 4 that you need to know, which I shall tell you. At the cheek left point, you put your needle to the fullest depth and you give strong stimulation till you produce ter chi. Now, when you know a lot of theories, it's dangerous because you may not know what to do with it. The practical part is most important, you see. So that is why you have learned a lot of theory, but you don't know what the devil to do with when you take a needle. Huh? Many years ago, one day I met one morning a beautiful girl in Hyde Park. Early morning, she was crying. So I asked her, why are you crying? And she said, I am crying because last night I got married for the 3rd time and because I am still a virgin. So I asked her, well, how come? And she said, I liked very muscular men. So I married a man who was a boxer. And he was very romantic. He took me to an old hotel, woodwork and all that upstairs from our honeymoon. And he wanted to show his muscles, so he brought his boxing gloves. He went round boxing the wall. The last shot he gave was on a window which was not properly fixed, antique window, and he fell to his death. Second man I got married was a weightlifter, you understand? Lot of muscles. He took me to a similar hotel, he brought his weight, he was lifting them. And the last weight was the heaviest, and he crashed through the floorboards because they were old, antique, and he fell to his death. So I decided not to get married to any muscular men. So I got married to another man who was not muscular, who was working in an office. And last night was our honeymoon. He sat at the edge of the bed and told me the entire plan about sex and about all that, but he did nothing about it. That is why I am still a virgin. And he was from the planning ministry, you understand. And so, although you know the entire plan, you must do something about it. Now, if you read this book, you will see very carefully, at every point is told the exact depth that must be inserted. Now, that is the one thing you should not do. What is described as the depth of the needle is the maximum depth that you put it, but most of the time you just hang it under the skin, that is enough, painlessly, and I will show you how to insert it. You insert the full depth as is described and give strong stimulation under the following conditions. If there is severe pain, if there is a acute disorder, we have told you, acute disorder, severe pain, you do that. And if there is a acute emergency, such as the man has stopped breathing, the man has fainted, we give a person who has severe weakness of muscles. Severe weakness. Excess of yin is yang. Acute disorder, such as acute attack of asthma. That is what we use for an acute attack of asthma, that is the cheek left point. Severe pain or surgery. In an emergency, somebody has fainted, we give very severe stimulation to the point of pain, severe pain, emergency, and in a very severe weakness of muscles. This is all guided by a law. Somebody asked yesterday from Dr. Strauss, Bu Shi. You remember somebody mentioned? Who mentioned that? Bu Shi. Who mentioned? The Chinese had several laws. One of the most ancient civilized peoples, you will agree. There's laws for astronomy, they had laws for cosmology, laws to carry out irrigation, the laws of behavior in church and temple and funerals. You understand? How to behave at a party. All they had very severe laws. Confucian social laws were 3,000. And educated Mandarin had to know all those laws. Otherwise he did not become a Mandarin. Right? And everybody, that is the norms of behavior in society. In all their disciplines, whether it was buildings or whether it was war, there were laws. But out of all those laws, there was only one law that they gave a name, the great law of Bu Shi. That is the great law of Bu Shi. The great law of Bu and Shi is as follows. Bu and Shi. Bu means to tonify or to increase the energy at the point. Shi means to reduce. Right? Now, what is Bu and what is Shi? Bu is, you use a thin needle. You use it superficial. You do not stimulate too much. We will say little or no stimulation. Put it clockwise. Use gold needles. And close the hole when you take it out. And many other methods, the time of the day, all that. Thick needle, was chi. Put it very deep, full depth. Stimulation very strong till you get dirt chi. Clockwise and counterclockwise. Gold needles on this side, silver on the other side, and leave the hole open, and so on, many others. These were, in ancient times, the description of the great law of Bushi. In other words, what does the law state? The great law of Bushi states, always use Bu and only use Chi in these exceptional circumstances. That is, very acute, very severe pain during surgery, emergency, or severe weakness of muscles. The great law of Bushi states, always carry out Bu, that is tonification, and sedation only when required. This is tonification, that is sedation. Under those exceptional circumstances only do you carry it out. Now I want you to understand what is the purpose of it. What is the purpose of the law of Bushi? If you are going to simplify it so that ordinary people can understand, how would you transliterate the law of Bushi? This is the way you do it. The great law of Bushi states, don't hurt the bloody patient unnecessarily. Now remember that. Please write it down. Don't hurt the bloody patient unnecessarily. Always take a needle in your hand, look up to the Almighty and say, I am not going to hurt it, or even cause dirty, nothing, unless those very conditions are there. You got that? This is something that is not made clear in the world of acupuncture. And I am not shy to tell you, I took 15 years to learn it myself, what it was all about. I was merrily putting needles all over the place, thick and thin. So, take your needle and take your needle. Have you taken your needle? Right. Hold it in any way you like, right? Take your needle. If you want to insert with your needle guides, then I don't have to tell you anything. You just push your finger like this. But the art of the acupuncturist is not to have needle guides, but to put it straight with your, hold the needle, right, and with your wrist, come near the point that you insert it, right, take it back very quickly, see, as hard and fast as possible. The barefoot doctors were told to put it very gently under the skin and rotate it in. Of course, it takes 10 times more time and it is 10 times more uncomfortable. Take it. If you are going to stab a man, if you put the knife in and slowly put it in, it's going to push him one shot. He won't even know that you have stabbed him, you run away. You understand? So that is the way you do it. Right. You hold it, right, and take it like this here. Right. As fast as possible. Fast insertion, right there. So fast that the patient should not be able to, right? And as you put it, it is a good practice that, you know, this leading finger, middle finger, as you put it in, right, you follow up, you know, follow up by pushing your finger on the skin. So the brain is feeling something funny, you know, and it doesn't get any uncomfort. Yes? You push this finger also into the skin, right there. Don't leave your fingers in the air. You understand? Don't leave your fingers in the air. As you do it, follow through. You understand? See? Yeah. That is the way. Go and practice it on your pillow. I tell my friends in Sri Lanka, my students, to take a papaya and put it all night into the papaya. In the morning, cut the papaya and eat it. Come to the clinic. So the art of it is practice. First is not in your hand, right? Close your eyes. All of you close your eyes. Now imagine you have a needle in your hand. Then imagine this is the exact point I must get it. And then you take it back, right, and push it in hard into that point, right? You have to program your mind first. It is not with the hand. You understand? Program your mind to do that. And once you've done it, faster and faster and faster is what you must do. That is the way you needle. It's quite easy. And you have reached, you have graduated when you are able to needle little children. First is not the needle. When children come, you must have plenty of chocolates and toffees and all kinds of things. And you must learn the fine art of talking nonsense. The greatest achievement of a doctor is to talk nonsense, you understand? Because our job is a very grim job. Every day I have more than sometimes 200, 300 patients. See, from morning 7 o'clock, 8 o'clock, you see pathology, till late in the night. So the only way to preserve your own sanity is to talk nonsense, you understand? And when you talk nonsense, the patient thinks, after all, this guy talks nonsense with me, I can also talk sense with him. He's very open and free. Further, patient thinks, oh, I can't be having anything very serious if he's talking such nonsense. You understand? So that is the way. That is what I have shown you as the boo. Just put it, that is the boo. Now let us come to the she. The she is, when you do the she, right there, when you do the she, right, you take fairly a firmer grip on the needle. Take full grip of it and push it right in one shot. And full grip of it. If you can't, sad to say, you have to use a little more force and put it in. To the full depth that is described. For example, at the she cleft point, okay? Give me one of your clean needles, Right. And it is a good thing also for you to learn how to acupuncture yourself, right? It is that is the most difficult part. You can acupuncture lots of people, right? Learn how to acupuncture yourself. And then you get hold of it, right? And you like this. I'll show you how to do it. Yes, very fine. Very good. Yeah. Turn this and you will feel a very funny sensation. That is called dirty. Have you tried that? Right. It is numbness, heaviness, soreness, distension, and not exactly pain, And as if the whole arm is becoming limp, heavy. Now, let this be a lesson to you. I gave you for every disease whole heap of points, right? Can you imagine the patient has to tolerate all those points? So, remember, never to put all those points. If that is all what you have learned, good enough. 1 or 2 points the maximum. See that each person is different, but you see, he doesn't even know that it went. He's asking, is it okay? You felt nothing?
Something, but no,
nothing, no pain there. That is one of the reasons somebody asked me a question. You put Pahui, you start there, never start here. Never start in that area. First they avoid that area. This is the most difficult area. There, the local areas are less painful. Now, in stimulating, this is the way you stimulate. Put the needle to the full depth and then take it up and down about not 10 kilometers, only 1 or 2 millimeters, right? 1 or 2 millimeters, very little. And turn the needle about not more than 360 degrees. Otherwise, sensitive tissue, nerves, fibrous tissue can get involved, can get twisted, and you can have severe pain and shock. So lifting and thrusting and rotation of the needle. And I do it like this, and then I rotate it like this, up and down, very gently. Looking at you remember, doctor, looking at the patient's face, then you know when he does that, like this. The greatest of the most experienced Chinese acupuncturists They do it like this. Put your hands like this. Bend all those 4 fingers. Bend them, right? And let those fingers not move, fully bent. Put your needle there. Put your needle there, and you rotate. You see that? You rotate it with your thumb. This 4 fingers should not move. Take your pen or take your needle and try it. And all the time you move up and down from the wrist, right? Practice that is a little difficult, right? That is how the experts do it. But if you do it like this, it's all right. And you do that till the patient gets dirty. That is the great law of Wuxi. You do the sedation or the Shi method only in very exceptional cases. And the point Shi, that is called Shi cleft point, is for acute disorders. There are Shi cleft points for every channel, but the more important Shi cleft points are as follows. Stomach 34. These are the important Shi cleft points. You know the point Shenman, you remember? And half Chun below that, before that, is the point which is called Yingxi, heart 6. If somebody has emergency of the heart, right, any heart emergency, acute pain, ischemic heart disease, you can send him to intensive care, but till you send, you can use that point. Anxiety, severe depression, he's trying to commit suicide, all you can use. Impending stroke, that is a circulatory problem, you can use that. Put your needle and give strong stimulation. If you do not have a needle, you may be up in the air, 30,000 feet. It has happened to me. Flying to Mexico, man, use your finger very hard. Put your fingernail, you get a sickening feeling, and stimulate it with the fingernail. Put your finger at lung 7. How does the channel go? From here, up here. 2 finger breaths. How many Chun? 1.5 on the radial aspect. That is the point called Lie Chia, lung 7. Lie Chia means out of line. Now, Lie Chia, lung 7, what is it used for? Very good, excellent man. Right. Local disorders, adjacent area, along the channel, pertaining organ, coupled organ and channel, special sense organ, tissue, excess in the mother and deficient in the son. Excellent. Apart from that, it is used for what are called distal points. Points distal to the elbow, distal to the knee are called distal points. We told you that yesterday. And they are used to treat proximal disorders. How many distal points are there? What is the correct answer? The correct answer is there are so many I did not have time to count. However, there are 6 important, frequently used distal points, right? How many? 3 in the upper limb, 3 in the lower limb. Now tell me, what are the 3 in the upper limb? Put your hand here, finger here, that is, what is this one? Hoku, large intestine 4. What is this? Lieche, lung 7. What is this one? Neck 1, pericardium 6. Shall we go through this again? They are deadly important, whether you like it or not. Hoku, Lieche, neck 1. Yes, 3 more in the leg, which are, can you guess? Susan Lee, Saninjiao, whatever you say, right? Susan Lee, Saninjiao, and we have Wei Shong, which is in the back of the knee, UB40, you remember? Tai Chong is the same as Hoku. We don't need to discuss it, is a distal point for all diseases. When Tai Chong, liver 3, liver 3. When you talk of liver 3, it's the hope of the foot. Those 6, if you turn to this page, where is this page? Here you are. What is this page? Please turn to page 121, 122. 121, 122. 121, 122. There it is, the whole story. All right? It's in the card also. In the card, where is it in the card? Yes, side B, top right-hand corner. Those who want to see the card. When you study the outside of that card, you have studied it all. Do this, everybody. It is the proximal area for the front of the, who said face? Let me see the back of your face. Somebody said. Very dangerous person, two-faced. Front face, don't have anything to do with him, huh? Right. Front of the head, face with the special sense organ, and front of the neck, that is the proximal area. Again, front of the head, face with special sense organ, and front of the neck. Then we have liache, put on the other side, liache, back of the head, neck, come down, spine and lungs. Right. The other right side, right. Back of the head, neck, spine and lungs. Neck 1, pericardium 6. Chest and upper half of the abdomen. Nausea, vomiting, chest pain, all that, hiccup we can. Got that? So that is the proximal area. Right. So once again, Hoku, front of the head, face, special sense organ, front of the neck. Liache, head, neck, spine and lungs. Neck 1, chest and upper half of the abdomen. Susan Lee, put your finger, both Susan Lee. Both fingers. Right. Susan Lee, what happens? Take it up the entire abdomen. That is why we used in that cesarean section. You remember my beautiful girl, Susan Lee. Back of the knee, doctor, turn the other way. Right. Put your finger on the back of the knee, Weizhong UB40, take it up, take it up, take it up, take it up. Low back ache, sciatica, genitourinary disorders. Right, turn this way, doctor. Right. Got that? Susan Lee, all abdominal disorders. Weizhong UB40, low back ache, sciatica, genitourinary disorders. Now look at this. Put your finger at the Saninjiao, spleen 6. Take it up, take it up, take it up, take it up. Hold this here on the middle. There. What is this? Perineum, pelvic disorders, and external genitalia. Right? Perineum, pelvic disorders, external genitalia. That's all you must know, the outer side of these. Right? That's all I know, for that matter. Right. That is the quintessence and the summary. So that is all I recommend you to buy. Right, this one. If you don't have it, tell me, I will send you. Free. Right. 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 You have a look at that. Now, I will draw, this is the channel. You can see, you start here, here. Shenman, you know Shenman? Heart 7, yeah. 1, 3, 7, 6, 5, 4. And this is 8, 9. Can you see the points? Now you look at the points again repeated, please, on the B side of the card. B side of the card, turn to the heart channel. Can you see that? B side, heart channel. This one, each of these, please, you must get right. You got that? Now, you see, distal to the elbow, we were talking in the morning, there are all the 5 element points are there in every channel. And the 5 element points you will see are water point, metal point, right? Wood point, fire point, earth point. Do you see that? Right. That is the fire point, number 8. That is the earth point. That is the metal point. That is the water point. And that is the wood point. There are 12 channels. In each of them there are 5 element points. 5 into 12 is 60. And those are called the 60 cardinal points of acupuncture. And at the very highest level, you take the symptoms and do a Sang Fu differentiation. You see the tongue, you feel the pulse, and the master acupuncturist then decides how to transfer the energy on the 5 element channel. And in this case, we have to transfer the energy, the wood energy, into the fire, so we needle the wood point. So we put this needle here and leave it alone. Where exactly do you put the needle? Right, that is my finger. Little finger. My little finger of the right side, and this is where I put it. Heart 9, Shao Chong. Did you see from your computer card? We call this the computer card. Did you see from the computer card what the point is? Everybody comfortable? Yes. Because heart is fire. Why did I pick the heart? Because we are transferring from the liver to the heart. Deficiency of fire and excess of wood. That is migraine, right? Very good. So we picked the heart line. Very good question. Of course, there are 4 fire channels. Heart is the most important. Heart, pericardium. That is how you treat. The whole story sounds like Aesop's fables, or like from Alice in Wonderland. You know that? If you just stand there and tell people these things are like that, they don't believe. But the strange thing is, it works. You have a choice of heart or pericardium. You can use pericardium point also, but that is the center. It is better for you to get the Prime Minister to act than the Prime Minister's bodyguard, which is the pericardium. Understand? Good question. Not through yang, but through the yin. So, that is all. The whole thing does not make any scientific sense to you, neither to me, I confess. But that is the theory behind it. That is the thinking, all based on Taoism. And my God, it works. Now this is another important point you must know. Ren 17. Where is Ren 17? Anybody knows? Take your 2 nipples, put your finger, and exactly the middle point. That point has many functions. As a local point, it treats disorders of the heart, disorders of the pericardium, disorders of the lungs. Asthmas, we use it. But apart from being a local point, it is the influential point for respiratory disorders. Now, please pick up your card and you will see. You will see on the A side, top left-hand corner, A side, top left-hand corner, 8 influential points. 8 influential. Can you see that? Those 8 influential points are for 8 different tissues. Shansong Ren 17, between the 2 nipples, is for treating respiratory disorders. Did you see that, doctor? A side. A side, yeah, outside, yeah. Here. And you will find we start there, respiratory disorders. Disorders of what? Now listen carefully. Disorders of the lung, of the nose, of the sinuses, and of the skin. Why? Why the skin? We said this is my nose, element, metal, color, white, related to lung, large, and to my skin. They are all one element, lung. Doctor, you ask what is the meaning of an organ? That is the meaning of the organ. The nose, the sinus, the respiratory, lung, large intestine, skin. It is a combination of anatomy, physiology, pathology, and it's very fuzzy. It is not something honeycomb I can say this is my lungs or this is my breast, nothing. It is a very diffuse idea. Ren 17 is the point which is the influential point. And now I am going to show you how the yin energy changes into yang energy. That is the lung channel, and in the lung channel, that is how it flows, and that energy changes into the yang energy of the large intestine in that direction. And there are 2 points here and here that is connected, and here there are 2 points which are connected, and these points are as follows: lung 9, large intestine 6, this is lung 7, large intestine 4. The energy travels only in one direction in this channel, in this channel. In these, it can travel in either direction in order to balance the energies. They are called the Luo connection. Luo means connection in Chinese. Luo. There are 2 Luos connecting in order to balance the energies. And one of them, this is called the Yuan source point, Yuan, and this is called the Luo. Luo actually means a dough, and this is the Luo, and that is the Yuan. Yuan means the origin, and the Luo, the connection, and the door to the connection is Luo. In the 2, if there are 2 pots of water, here we see 2 pots of water, 2 water tanks. If you want to keep the balance between them, you can do it by connecting 2 pipes. They will keep the balance. That is what we have done. At the Yuan points, the cold water is made hot water. You understand, like a geyser. The yin is made hot and sent as yang to help to balance them. Now, that is how the energy changes. If there is a imbalance such as stomach disorder and lung disorder, asthma and diarrhea, bronchitis and constipation, right? Skin disease and asthma, rhinitis and constipation. Those are all yin-yang imbalances within the same element. Then what we do is we needle all those 4 points together in the direction of the center, like this and like this. Did you understand that? Yes? I will show you. That is the needle, that is the needle, that is the needle, that is the needle. Did you understand? This way, that way, this way, that way. And you needle the right side in a woman and the left side in a man. Left side in a man, just like the confluent points. It's good practice. So, if I have a problem, say I have diarrhea and bronchitis, very common problems. Here, I put it on these four. If it is in a woman, this side. However, the greatest of acupuncturists do not use 4 at all. They find out which side is deficient, which side is excess. See, we have the yin and the yang, lung and large intestine. The imbalance is always one side is excess, the other side is deficient. We find which is the deficient side, which is the excess side. And we open the luo of the deficient side, the door of the deficient side, and allow the energy to come in. Instead of 4, you use 1 needle. If you are a highly specialized physician of traditional Chinese medicine. Although the story I have told you is very simple, to master this whole subject it takes 100 or more years. It is a bottomless well. There is no end to learning this. You might go home and think, now, right, if you know how to put the needle, you can practice acupuncture in nearly every patient you come. But the theory and the philosophy of it, it is a bottomless well. So therefore you can put your 4 needles if you think that there is a large intestine lung disorder, or skin large intestine disorder, or nose skin disorder. You can put it to balance it. But if you know which side is deficient, whether it is yin or yang, and of course you know large intestine is the yang, that is the yang, and this is the yin, that is the yang, that is the yin. Their organs are the tongue and the fu, their organs. And whichever side is deficient, if this side is deficient, you put the needle only there. If this side is deficient, you put the needle only there. Luo connection of the deficient side. Many complicated syndromes involving kidney, urinary bladder, liver, gallbladder, stomach, digestion, Yuan-So's luo connecting points are helpful. But if you don't know anything about that, don't worry about it. You put Pahui, local, distal, full stop. One last thing we come to is, we have already discussed the 5 elements. There is fire, there is earth, there is metal, there is water, and there is wood. And you know those are the different elements. You throw water into your garden, what happens? You get trees, that is wood. And in the winter, we make a fire out of it. And the fire burns into the ground and forms part of the earth. And from the earth, that is where we get our metals, the solid state. And from the solid, we get the liquid state. And this is running clockwise. Fire, earth, metal, water and wood. All right? We have On the Taoistic theory, this was propounded, and we have kidney, urinary bladder, we have liver, gallbladder, we have heart surrounded by pericardium, small intestine surrounded by the Sanjiao, and we have spleen, stomach, and lung, large intestine as the internal organs. Now yesterday we gave us an example, migraine. What is migraine? We said all the symptoms fit into excess of liver, deficiency of heart, so you bring the extra energy here. That is, what is the treatment of migraine? Heart 9, the wood point. We treat bronchial asthma as follows. Governing point, local points, distal points, influential point, and any specific points. You know the story. Wash your hands, smile at the patient, take the chon. Have you had your breakfast? Take the needle. Governing point. What is the governing point? Very good. Do 20. Local points in front of the chest, back of the chest. Distal point for lungs. Of those 6, which one? Very good, lung 7. What else for lung 7? Influential point, what? Here, very good, here we have got it already here. Specific points, anti-allergic point, what is that? Anti-allergic, anti-inflammatory, Shueha spleen 10, very good. And press needle in the ear, where in the area, I told you yesterday about heart area, on either side is the lung area. Deepest point on the cavum is the lung area. Heart-lung area we give it. And in an acute attack, we have, how do you treat an acute attack of asthma? Kong Sui lung 6, water comes from the tap, you remember. Cheek left point. Right, cheek left point is lung 6. And there is also, for an acute attack, specific point here. This is a beautiful point. Though dangerous, that is what we use it for. What is the point? This is how we use it. Have the patient seated, take the chon, put the needle. Can I borrow your pen? Use that. Perpendicular to half to 1/3 of a chon. Perpendicular. Then extend the neck, change the direction between the sternum and the trachea, 1 to 1.5 chon, and get the patient to swallow. It will not be uncomfortable if you have put it correctly. If it has stuck the trachea, it will be uncomfortable. And do not, if it has stuck the trachea, take it off, put it back again. Right. And do not stimulate. You must not stimulate the acupuncture point with the needle at the dangerous points. do not. No she, only boo. And within 1 to 5 minutes, the acute asthma will disappear. So the prescription for is, I usually use those two. Also, in the 5-element theory, this is all I use 99% of the time. Very occasionally it does not respond to that. According to the 5-element theory, fire, earth, metal, water. Acute asthma is an excess of metal. Acute asthma is an excess of metal. So what do you do according to the mother-son law? Take the excess to the sun, here to the water. So you take the water, kidney channel, and what point do you use? The metal point of the kidney channel. Okay, see what is the metal point of the kidney channel? Right, kidney channel, kidney number 7, 25. Where is kidney number 7? It is 1 chun below Sanjiao. No doubt, we are completely baffled by how acupuncture works. It would be very dishonest for me to try to give you unnecessary alibis. The simple answer is, we do not know how any of these things work. We have lots of theories, but it works. I hope I have been able to stimulate you in order to carry our battle further, and the battle is on behalf of the suffering humanity, of which we will also be part of someday, sooner or later. I hope for all of you as late as possible. And in that spirit, let us structure, by the end of this century, a better medicine, which is an integration of the best parts of all these different medicines. As I see, most of you are all very young people. You have a lot of time in front of you. For me, the time is fast. I am on my last round in the marathon. I have done all the things in life I never wanted to do, in fact. And if I have inspired you, in order to go and study further, and in a very humble spirit, we admit that we know very little about medicine. We know very little about curing, and do what is the least invasive and the least damaging for the patient. I thank you for giving me a ear and for your tolerance, and in the warm, friendly spirit that you have once again welcomed me to this area. I hope, God willing, in October I may come back and tell you further. Many areas I skip through very quickly. There are lots of other things in neurophysiology, lots of different diseases which we should have discussed. What is to be done? When you think it is 4 days is a long time, it is not. Not even 40 days can we finish all this. There is a deluge of information. I hope you will take back to wherever you came from and be a service to your humanity. And I say that I know better than my teachers, because I have taken their knowledge and put my experience. When we sit on the shoulders of a giant, we see further than the giant. And in like spirit, I will be very pleased that you will take all this and work it to a greater height than me, and practice it better, write greater books, and come back and also teach me.